Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Now, today's guest, you're going to love her, Julia Holden. She's going to talk to us about how you don't need more restrictions. You need a plan that works for who you are. Julia is all about helping you create a healthy, balanced life that feels good and actually sticks because it's built around your story. But before we jump into talking with Julia, just a quick message from our sponsor, Grow Solutions, where we help health and wellness professionals discover how to double their impact and income without doubling their workload. We help people generate leads, patients, clients, whatever it may be, help you with the operational chaos using proven systems and frameworks, and of course, utilizing AI and especially AI bots because they're coming whether we like it or not. So Grow Solutions is not an agency or a vendor. We are your growth partner. So what if you've said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. Just drop the word grow below or feel free to reach out to me on any social platform. But you're here for a reason today, and that's to meet our amazing guest. Julia, welcome to the Prime Health Podcast, and please do share a little bit about yourself and what you do.
Thanks for having me. I'm a functional medicine certified health coach and a certified personal trainer. I'm the owner of Holden Lifestyle Health. I help people adopt healthy lifestyle changes that are sustainable and meet their unique needs. I have a strong focus on helping people find positive associations with health and wellness rather than it feeling forced.
I like that. I typically have a question I ask, but tell me what you mean by that versus feeling forced and that positive association, because too often people don't like to be pushed into improving their health, right?
Yes. So when I think of, sustainability, I think of making healthy choices part of your natural life without feeling like, oh, I have to go to the gym because I have a vacation coming up and I want to look good in my bathing suit. Or, oh, I should be eating, this meal that doesn't really sound good to me, but, it's lower calories. Mm-hmm. I help people find habits that they feel good about, that they get excited about, that are appealing to them, that they're going to, because consistency is key, in living a healthy lifestyle. And so, I like people to feel good about these choices that they're making and they want to do them versus feeling like, oh, I just have to do this because I want to get to, a certain outcome.
Yeah. Great points. And it makes it easier on you. And it's very important for your clients that they feel good about the process that they're going through. So I typically start this question off almost always, but that would be, was there a moment in life or there a circumstance that said, you know what, I want to go into this line of work, which is in healthcare and helping people?
There wasn't one specific moment, but, a couple of years ago, I was having some kind of minor health issues that I had been dealing with and not really seeing results. And I started looking into functional medicine, which is getting to the root cause of your symptoms. And I went to see a functional medicine practitioner who really helped me find some lifestyle things I could be doing that would help what I was going through. And over time, I really started to see improvement in myself. And I was really excited about the fact that just by changing up some things in my life and getting that personalized support from that healthcare provider, I started to see, results from that. And it was around that same time I was having some questions and doubts about the career path that I was in. I worked in corporate healthcare marketing and PR for 10 years. And I just wasn't feeling very aligned with that or passionate about it. And so I was kind of looking around to see if there's something else that would better suit me. So I looked into just kind of started browsing functional medicine jobs and what was out there. And the first search result that came up was the Functional Medicine Coaching Academy, which is the program that I decided to go through. And so that's kind of how I got started.
I love it. So you kind of have a dual credential, I guess, if you wish. I want to talk about the first one, which is your health coaching, but specifically the functional medicine. So what do you feel that you do better than most when it comes to helping your clients with functional medicine health coaching?
So I really love the fact that my health coaching certification came with that functional medicine foundation. So, although coaches aren't really, supposed to be the experts, we're supposed to help our clients be the experts in their own lives and kind of ask the right questions and guide them to, a better optimal lifestyle. The functional medicine piece, I think, is so important to have that understanding and to kind of have that value as you go through the process with the clients that we work with. Because, what I work with them on primarily are the modifiable lifestyle factors. So sleep health, nutrition, movement, stress reduction, and social connection. And all of those pieces are kind of like the foundations of a healthy lifestyle. Obviously, there's a lot more of things that you can do for your health outside of those areas, but those are kind of the basic building blocks, which I think if those are out of line and not being, optimized or addressed, you might have, some symptoms or some, negative health outcomes along the way. So I think that part of the functional medicine piece is like addressing the foundation, getting to the root cause, making sure that you're doing first things first before looking into like other options is very important. And yeah, what makes me different from other health coaches is that functional medicine piece. And then I like to help people find the joy in that process.
Okay. I love that. Finding joy in life is difficult. Finding joy in changing the way you approach health has got to be another, a different, unique perspective. So I'm glad that you do that because I think that people need that. It's not, mindset is a big shift. You kind of address that, yeah. It's a big shift for people to make a change in their health. In order to do that, they have to make a change in their mindset.
Yep. Yeah. Positive mindset makes a big difference when you're looking at habit formation and starting a new habit.
Absolutely. So as you've done the health coaching, the functional side of it, then you have recently or moderately recently added in personal training to that as well. What was the impetus to want to do that?
Yeah. So very true. I kind of added the personal training part just recently in the past few weeks. Oh, wow. And I've always been a lover of fitness. I studied it briefly in college before switching to a degree in public health. If I could go backwards, I would have stayed in that, first exercise kinesiology major I had. But I found my way back to it because after I was certified as a health coach, I thought I really want to be able to help people with more targeted guidance related to their fitness goals for those clients that want to work on their. And I really wanted to be able to provide that specific and personalized guidance because that's so important when people are wanting a certain outcome based on their health goals, whether that's building muscle or, improving their endurance or fat loss. There's specific workouts that you can be doing that are going to get you there. And I think it's important to be able to help people know what to be doing to be effective so that they can reach that health goal of theirs.
Yeah. And I know you've just started it, but I can only imagine that it's a better enhancement. We have to be careful how I make this statement. You have a health coach that does functional medicine, and you have a health coach that does functional medicine that adds personal training into it. I would assume the third version is going to get the greatest results overall for the patient because you're addressing three facets up to their life and their lifestyle.
Yeah, definitely. And when I first wanted to pursue the personal training piece, I thought, it will just help me be a better health coach. But I quickly realized when I started doing the program that there are preliminary assessments that need to be done when you are training or you start training someone or writing them a workout plan. And so then that made me think, okay, I can't just really be offering, tidbits. I can when I'm health coaching, but I want to offer it as a separate service as well. You can do health coaching, you can do personal training, or you can bundle them together and do both, which, would give you the best results. But if you do the personal training piece, that just ensures that I'm doing the proper and safe assessments before writing you a workout plan and telling you what you should be doing.
Yeah, love that. So do you see a majority of your clients locally to where you're at? Do you do a virtual practice as well? How does that work for your business?
I do mostly virtual. So the health coaching piece is all virtual. I'm able to do it, just over the computer like this. I also offer a virtual personal training service. So I have an app that I can deliver your workouts to you on. And I would do the assessments virtually and then do proper intake and some, calls before we get into me writing you a workout plan and delivering you the workout through the app that you would do on your own. I also, though, offer live in-person training here in Chicago for anyone who's local. I have a gym that I have partnered with where I would train clients, and there would be no membership required of the client. So they would just, if they're working with me as their personal trainer, we have access to that gym.
That's a bonus to work with you for sure.
Yeah, I think so.
Prices in Chicago and health clubs aren't cheap. That's for sure. Okay, Julia, I'd love to ask you this question. Who is your ideal customer, client, patient?
Yeah, so my ideal client would be an adult who feels like they have tried a lot of different things for their health and they're just not seeing the results that they would like. They have, tried something that maybe worked for their friend or someone they know, and it's just not working for them. The one thing about health coaching is, a lot of people know what they should be doing, but they just aren't able to actually implement it into their lives. When it comes to actually sticking with something consistently, that's where things can get a little gray. And so as a health coach, I would love to work with someone that they probably know, like, oh, maybe I should be eating healthy. Oh, maybe I should start working out more. Or, oh, I really need to address my stress, but they just haven't set aside the time for it. Or maybe they've tried and failed and they just need that extra support and guidance from.
Love that. Great answer. Because everybody is unique in what they're doing. We all know that I shouldn't sneak that extra candy bar. It tastes good, but I shouldn't do it. But it's always easier if you have an accountability partner help you through that. So when it comes into healthcare, anything of that nature, it's difficult to build trust. When it comes to you doing virtual coaching, how do you think that you build trust with your clients to help them to get their end goal result?
I build trust by listening to my clients first and foremost. I really like to get to know them and see them as a unique individual with their own story, their own experiences, and their own current circumstances. Mm-hmm. I treat everyone like individually. I see them as their own person. I'm not going to try to recommend something to someone just because it worked for someone else. And I think getting to know someone and listening to their side of the story, letting them speak. As a coach, I'm supposed to do more of the listening versus the talking. And I think that builds trust because they know that I am looking out for their best interests and I want what we work on to really be unique and personalized to them so that they feel like they are empowered and this was something that they're doing for themselves. And yeah, I guess that's it.
That's very good. So it's very unique. It's difficult for people to always make that decision to say, hey, I do want to make a change in my life, but then they got to trust the person on the other end. You get better results when it's there. When you go into just the medical doctor and say, hey, my blood sugars are up or down, it's a one-off visit. You're building this trust over time with people. You're building your relationship. You're helping build them along the way. So doing a great job of building trust, I think, is critical in any business, but especially when it comes to health coaching.
Yeah, definitely. And I'm able to spend a lot more time with my clients than, a typical doctor is able to and has the time for. I'm able to spend, 45 minutes or so, every week over, a series of weeks with my clients where I can really get to know them and, let them open up to me and we can find solutions together.
Yeah, I love that. So since you do a great job in finding clients, you do a great job in building that trust. Can you share a success story or two of some clients that you've had?
Yeah, definitely. I'm excited to. So I have a client that I've been working with for most of this year, and he had a goal to start eating better, start making healthier choices, when it comes to eating at home and eating out, and also cutting back on alcohol. And he has been able to meet those weekly goals that we set for him in regards to those two areas. And he lost 11 pounds since working with me over a few months.
Okay.
And he just really is feeling empowered to be in control of his health because he's more.
I love that. So that's a male patient that over a few, 3-4 months longer lost 11 pounds.
Yeah, it was. He actually worked with me for a package, and then he renewed with me again. So I'd have to go back and look at the dates, but it was probably around 4 months, if not a little more.
That's wonderful. It's not everybody wants to lose 11 pounds tomorrow because they want to fit into that swimsuit. But it's good. I think it's better to have it, over a sustained period. Any other success stories you have that you could share with us?
Yeah, I have another client who I really enjoyed working with who wanted to start being more physically active due to the fact that heart disease runs in his family. And so he wanted to find some activities that he could do that he was excited about. And, just by asking certain questions and letting him do the talking and kind of helping him feel empowered to make the decision, he found 2 different types of workouts that he was so pumped about. And, one was more like cardio related. The other one was more muscle building related. And he was just so excited. And because he chose workouts that that were specific to him, that he was like, no, this really sounds like something I would like to try. He was able to stick with his goals consistently, even when going on vacation. He even did his workouts, when he was on vacation with his family, which some people will, be like, oh, a vacation off, it's my week off. But he was really good and stuck with it. And in working with him, he improved his golf game. He loves golf, so he was able to improve his golf game with the activity that he had been doing. And he started getting comments from, which always feels good.
Yeah, absolutely. Well, good for you and good for them. I mean, that's always a reward. So as a health coach that does functional medicine, that does personal training, what do you feel is your biggest differentiator? What separates you from other people? If I still live back in Chicago, I did the same thing. What do you do better than I could do?
Oh, what could I do better than you could do? I don't know. That's
for a client. For a client. Yeah.
Okay.
Believe me, you could do way better than I could do, but for a client.
I think I've kind of mentioned this already, but really focusing on those positive associations with health. So by listening to my clients and really helping them find something that is going to be appealing to them, make them feel empowered, make them feel confident and capable. When you're, like I said, trying to build a new habit, it's very important to have positive emotions when you are doing that. The science backs that up too, to have a positive emotion with building a new habit, kind of that reward system. You're going to, you're more likely to keep coming back and doing it consistently. So I like to kind of, shed the fear of, feeling intimidated by something, or, only doing a workout, or only, doing something because you feel like you have to. I want people to want to do these things. I want it to feel natural to them. And so I help people find the joy in making healthier choices, because that's what I've been able to do for myself over the years. It takes time. It's like you said, it doesn't happen overnight, but I have a lot of different health practices that I do that keep me grounded, and I, come back to them because they make me feel energized, and I want other people to have that same experience.
Yeah. So as the winter season sets in there in the Chicagoland area, you have to make sure that you are finding joy in what happens, especially as the wind comes off the lake and it's sharp, cold wind that comes along with that. So if there's somebody that's watching or listening to this, Julia, and they want to learn more about you, whether they're local to you in the Chicagoland area or they're across the U.S., how would you like them to find more out about you?
Yeah, they can go to my website. It's holdenlifestylehealth.com. They can also find me on Instagram at Holden Lifestyle Health. I'm also on LinkedIn too, at Julia Holden, or Holden Lifestyle Health has its own page too.
Okay, I'll make sure to drop those links in our description for everybody to find that. So just two last questions here, actually three. What do you feel is the vision of your business in the next 3 to 5 years?
In the next 3 to 5 years, I would love to make my services more accessible to more people. Okay. So what I mean by that is more kind of generalized, more on-demand type of programming. Mm-hmm. So right now I do one-to-one services, one-to-one coaching. And, while that is, the, kind of top tier you can get when it comes to, support and, looking at your health, not everyone can afford to do that. And I would love to make more programming, whether that be like fitness advice or, nutrition, meal planning, things like downloaded by someone either via like my website or an app. I want to get my message out there to more people and make it more accessible.
Yeah. Well, I'm sure you're working hard at doing that, and I commend you for that, because there's many more people that need your assistance, whether they know it or not yet. But they'll buy into who you are and the way you can build trust with them. So 2 last questions. As a health coach, lifestyle individual, personal trainer, functional medicine, what's one tip you could give our listeners and viewers that could help them change their life today?
I would say to not be sedentary. What I mean by that is some people think being sedentary, is just for someone that's on that show, like My 600-Pound Life or whatever that is, like, who sits on the couch all day. But being sedentary is actually, described as not doing at least 30 minutes of moderate intensity activity 3 times a week for at least 3 months. So that was kind of a mouthful, but I think being physically active and moving your body more, no matter how you're doing it, whether that's, walking, swimming, dancing, just get up and move your body more, because being sedentary is the 4th leading cause of death worldwide. And, can lead to chronic disease, as you get older. Mm-hmm. There's so many great benefits of being physically active and moving your body, whether it's your metabolic health, your cardiorespiratory health, mitochondrial health. It helps you sleep better. It improves your mental health and cognition. There's so many great benefits of just being more active and, trying to watch how much you sit on the couch and watch Netflix.
Yeah. Note to self this weekend, be active. Last question here, Julia. You're on the Prime Health podcast. What would your definition of Prime Health be?
My definition of Prime Health would be feeling that health and wellness, making healthier choices, is just a natural part of your lifestyle. Mm-hmm. You don't have to think about it. It's just something you reach for when you feel you need to go for a run to clear your head. When you feel like you want to make a nourishing soup because you want to get, some healthy vegetables and maybe some protein and nourishment from that. It's getting to bed early because you're going to feel good the next day if you get to bed on time and get some good sleep. I think Prime Health is living a healthier lifestyle, and it doesn't even feel like you're trying to. It just feels natural. It's second nature. Mm-hmm. It's just what you do to feel better. You want to do it versus feeling like you have to do it.
I love that. It's one of my favorite questions. Of course, it's self-gratifying. It's the Prime Health podcast, but I think your podcast number 54, never a repeat question so far, repeat answer, excuse me, very unique. So I appreciate the perspective you give us, Julia. And again, thank you very much for being a guest on here. I love the transition that you went in, knowing that you wanted to be in healthcare. You kind of made that switch away from it a little bit. You came back to it because you wanted to see changes in your life. And that's a great way to help other people, is when you can have proof. I climbed this mountain, so can you. I felt that way. You can feel better like I can. It allows, as you said, to build that trust because you're listening to your clients along the way. So thank you for sharing that with us. And I always say this, please, if there's somebody that's watching or listening and something that Julia said, and there's one person, just simply one, share it to more, but one person that can benefit from that, whether in the Chicagoland area or around the country, please do share this, because it's important that her message gets out. We want people to learn more about what she has to offer, because it is completely about improving our health, and our country needs that. So I'd also ask that you subscribe to the podcast. We always want to have more viewers and listeners on what we do. And as I always say here, until next time, remember that you are on a true wellness journey, and we're all on it together. So whether you're taking charge of your own health or guiding others in theirs, please stay committed to your Prime Health journey. And again, Julia, thank you very much for being a guest on the Prime Health Podcast.
Thank you so much for having me.